Hi, I'm Brooke Lilly, and this is my presentation on the function of the pulmonary surfactant. So today we will be discussing pulmonary surfactant, which is a crucial substance in lungs that help with proper respiratory function. Now, pulmonary surfactant plays an essential role in preventing the collapse of the alveoli, ensuring efficient gas exchange and reducing the effort needed for breathing. Now, this presentation is going to cover the composition, mechanism, action, and the clinical prevalence of surfactant in the lung physiology, especially focusing on conditions like neonatal respiratory distress syndrome and acute respiratory distress syndrome. So, what is pulmonary surfactant? Pulmonary surfactant is a complex mixture of lipids and protein that reduces surface tension in the lungs. It is essential for normal lung function and plays a critical role in maintaining the integrity of the alveoli, preventing the lung collapse during exhalation. So, the surfactant synthesis begins in newborns, and it continues to be produced throughout the life to support breathing efficiency. Now, pulmonary surfactant is a complex mixture of lipids and proteins. The most important lipid is the dipomethylphosphorylcholine, or the DPPC, which accounts for the majority of the surfactant. Now, this substance is crucial because it reduces the surface tension within the alveoli, the small air sacs in the lungs where oxygen and carbon dioxide exchanges takes place. Now, without sufficient surfactant, these alveoli could collapse, making it difficult to breathe. Now, surfactant production begins during the newborn development, and it's obviously going to continue in life in premature infants. However, this surfactant levels if they're insufficient, they could lead to a condition like neonatal respiratory distress system, which we will talk about later. Pulmonary surfactant is composed of about 90% lipids and 10% proteins. Now, the most abundant lipid in the surfactant is like I said, is the dipomethylphosphorylcholine, or the DPPC, which is essential for reducing surface tension. Now, the DPPC's structure allows it to spread out over the surface of the alveoli, creating a thin filament that prevents them from collapsing. In addition to lipids, the surfactant contains 4 surfactant proteins, A, B, C, and D. Now, these proteins are not only involved in the regulation and turnover of surfactant, but also serve an important immune function. Now, for example, surfactant protein A helps in the clearance of pathogens, and surfactant protein D has antimicrobial properties, aiding in lung defense by neutralizing harmful particles and bacteria that may enter the lungs. Now let's look at the mechanism of action. Now, pulmonary surfactant works by reducing the surface tension at the air-liquid interface in the alveoli. Now, without the surfactants, the cohesive forces between the water molecules would cause the alveoli to collapse, leading to difficulty in breathing. Now, the surfactant molecules, like the DPPC, insert themselves in between the water molecules at the alveolar surface, disrupting these cohesive forces and lowering the surface tension. This reduction in surface tension prevents the alveoli from collapsing during exhalation, and it makes it easier to expand the lungs during inhalation. So, for example, in a healthy adult, the surfactant ensures that the alveoli do not collapse at a low lung volumes and remain open for gas exchange even during normal breathing. So let's take a look at the role of the pulmonary surfactant. Now, the role of the pulmonary surfactant is to facilitate efficient lung function. First, it prevents alveolar collapse during exhalation, ensuring that the small air sacs do not lose their shape and are ready for their next breath. This is especially important during exhalation when the lung volume is reduced. Now, secondly, it's important by lowering surface tension. Now, surfactant reduces the work of breathing, making it easier for the lungs to expand with each inhalation. Thirdly, the surfactant helps maintain alveolar stability at different lung volumes, ensuring that gas exchange can occur efficiently regardless of the phase of breathing. And lastly, surfactant proteins like surfactant protein A helps protect the lungs from infection by clearing inhaled pathogens, acting as part of the body's immune response to foreign particles and bacteria. Now, like I mentioned earlier, let's go over our neonatal respiratory distress syndrome. So, a surfactant deficiency is a serious clinical condition, and this can particularly affect premature infants. In cases of neonatal respiratory distress syndrome, the infant's lungs have not yet produced enough surfactant to prevent the alveoli from collapsing. Now, this makes breathing difficult and can lead to respiratory failure if not treated. Now, let's just take a baby born prematurely at 24 weeks. They may have lungs that are not yet capable of producing enough surfactant, requiring immediate medical intervention. And doctors can diagnose this quickly by their fast breathing or grunting sounds, their nostrils flaring. They could have cyanosis, which is a blue coloring of the skins, and their chest can have retractions, right? That's the skin pulling in around the ribs during breathing. And of course, they're going to exhibit low oxygen levels. Now, the standard treatment for this condition is the administration of exogenous surfactant, which is surfactant that is made in a lab and delivered to the infant's lungs. Now, this treatment helps to reduce surface tension and ease the infant's breathing until their own surfactant production is sufficient. Now, additionally, surfactant deficiency is also a concern in adults with acute respiratory syndrome, which can occur after trauma or severe infection, like pneumonia. Now, in the acute respiratory deficiency, the surfactant dysfunction contributes to difficulty breathing and inadequate oxygenation. Now, with modern treatments like surfactant replacement and improved neonatal care, survival rates are going to be high, even for very premature babies. Now, long-term complications can include chronic lung disease in some cases, but luckily that with the modern treatments, they have a very high chance of survival. All right, now let's look at some callback questions. So if you're paying attention in this presentation, you could tell me what is the majority of pulmonary surfactant made of, and that's the lipid dipamylyl phospholyl choline, which is definitely a mouthful. And let's see, our next question, name one function of the pulmonary surfactant. Now, you could have said preventing alveolar collapse during exhalation. You could have said reducing the work of breathing by lowering the surface tension in the lungs. Or you could have said promoting alveolar stability during varying lung volumes, supporting immune defenses through surfactant proteins that can clear pathogens or particles. And then what is the clinical condition that results from a deficiency in pulmonary surfactant? And that could be related to neonatal respiratory distress syndrome. So in conclusion, pulmonary surfactant is critical for normal lung function. It reduces surface tension in the alveoli, preventing their collapse and ensuring efficient breathing and gas exchange. Now, surfactant also plays a role in defending the lungs from infections. And we talked about a deficiency of surfactant can be seen in conditions like neonatal respiratory distress syndrome and acute respiratory distress syndrome in adults. And that can lead to numerous respiratory conditions. Now, understanding the composition and function of this pulmonary surfactant is key to treating and managing these respiratory conditions effectively. Here's the references that I use in my presentation. Thank you so much.